we are still seeing rising hospitalizations, particularly with the case rate rising in older age groups. That is of concern. And I think we have to be honest, and when we look at the NHS, it will be a rocky few weeks ahead. And this is a reminder, really, there's a role for all of us to play in helping in this pandemic. And the best thing I think that anyone can do, if they haven't already, is please get boosted or get your first or second jab if you haven't had that. When I visited the ICU unit in this hospital today, for example, the ICU unit for COVID patients, I was told that they estimate around 70% of those patients are unvaccinated. And this really is a reminder to us all about the importance of getting vaccinated to protect yourself, your family, and your loved ones. Look, when we look at Omicron versus the previous waves, of course there are some encouraging signs. We know now that Omicron is less severe, both intrinsically, and we certainly know that once you get boosted, that your chance of hospitalization, our latest analysis shows, is almost 90% less than what it was with Delta. And of course this is good news, but we also know that it's highly, highly infectious. The ONS estimated that last week they think about 1 in 15 people in London were infected. We haven't seen infection rates like that with COVID before. So does that, that all that taken together does mean that with this high infection rate, despite the lower severity, we are seeing hospitalization. So we should remain cautious, and people are doing that. That's why the Prime Minister said we're sticking with Plan B for now. But also, again, I just can't stress enough the importance of getting vaccinated.
There have been reports today that you were opposed to the Prime Minister's decision to relax testing rules for international travel. Are you worried that doing so makes a future lockdown more likely?
Look, I want to see travel open up. I want to see it be made as easy as it possibly can be. It should always be a balanced and proportionate approach. And I think that the approach that we've taken, what we've announced this week, where we require people still, upon their return, to take a lateral flow test, and if they are positive, to take a confirmatory PCR test, I think this is the right balanced and proportionate approach.